Hi, everyone. Welcome to Black in Focus. I'm Karen Toulon here, Bloomberg headquarters in New York. Delighted to welcome back Dr. Italo Brown. He is Assistant Professor of Emergency Medicine at Stanford University. Good to see you, Dr. Brown.
Happy to be back here, Karen.
Right. And you're saying back here because we spoke last time, I think, on July 29th. And back then, schools were largely still out. A lot of places were still remote work. The Delta variant was really the talk of the town. Now we have new items to discuss: booster shots,
Right.
breakthrough infections. But I kind of want to start at the basics. Where are we right now with with the amount of infection that you're seeing and recovery rates? Kind of just give us that big overview.
Well, so what you're hearing is that people who are vaccinated and who are unvaccinated are experiencing two different realities, right? The vaccinated uh, are still susceptible to the virus, but are not having severe outcomes or not being hospitalized at the same rate as those who are unvaccinated. And we're
Mhm.
seeing those same disastrous outcomes in unvaccinated. And it happens a lot faster because these variants are starting to essentially, develop a lot more quickly. Naturally, is what viruses do. So I think that the biggest concern at this point is, how are we getting education around vaccination out? How are we making these decisions to be vaccinated? And what are we doing to kind of bridge that gap? Because the results are very clear. The outcomes are definitely stratified in that case.
So Bloomberg has a vaccine tracker that we've been doing, and right now about half of the U.S. population is fully vaccinated. Another 85% of adults have had at least one dose. That still leaves a lot of adults and a lot of young adults,
Right.
children, unvaccinated. Um, Boosters, right? So now we're talking. This is something we did not talk about in July.
Right.
Boosters are now much a topic of conversation. We had news today that a Pfizer, another drug combination is going to be effective, more effective. Tell us about boosters. How do they work? Are they necessary?
Sure. So the logic behind a booster shot is, at some point we know that the immune response, the antibodies that your body has generated because of the initial shot that you received, are going to wane, and so that booster shot essentially re-energizes those antibodies. It creates more of a lasting response if in case you develop a COVID or you get the coronavirus. Now, the concern with boosters are, can they be broadly recommended at this point? And I don't think that that's where we're at. What we're seeing is that people who have, increased risk are the ones who are getting offered the vaccine, and that's what we're seeing approved. And also, what we're trying to evaluate is, are there differences in the different types of vaccines in terms of that lasting immunity that comes with a booster shot? So I think that there was just information released that it's okay to get a Moderna vaccine as the booster. It's okay to get
Mhm,
Pfizer. Any of
mhm,
those are essentially approved as the booster dose. Before, it was you need to just stay with the same brand, like staying with Nike or staying with Adidas. These can now be mixed and matched. So I think that this is exciting news to know that the science is leading the decisions around what we're going to do regarding booster shots.
I hope this isn't a silly question, but once you get the booster, will you need to get the booster again? Is this a lifelong
I see
pattern
where
that
you're
we'll
going.
be in? Yeah.
Well, so I remember having it. I got an opportunity to talk to Dr. Fauci
Mhm.
several months ago, and he essentially was asked the same question. And it's too early to tell if that's going to be the trend. What we do know is that if you are having an antibody that is essentially going to wane after a certain amount of time and the threat is still elevated, it may be required in order to have the greatest good distributed. But what I will say is, there are actions that we can take individually to lower the likelihood of the virus being as virulent or of having negative outcomes that have nothing to do with the vaccine at all.
Okay, so what are those?
I continue to say this. we have to practice the same things we've been told to practice since the beginning of the pandemic: continued hand washing, making sure that we wear masks in appropriate spaces, making sure that we're talking openly with other individuals about their vaccination status so that we know what the likelihood of risk is, and making sure that those who are at most susceptible to the virus are protected.
So this is a real life example, and this isn't an invitation to the world to come, but we usually do a Christmas Eve dinner with other families. Can I have 20 people in my home if everyone's been vaccinated?
So, what we can tell by the signs is that if everyone is vaccinated, that means that all 20 of you have a lower likelihood of having a severe outcome if, in case one of those individuals is carrying coronavirus at that time. So, does that mean you can have the party? Yes. Should you have that party? That's the discussion that you need to have with yourself and all 20 of those individuals. Now, what I truly believe is these smaller, intimate celebrations have become a staple, and we can do those same types of setups where you're using virtual tools to make sure that there's interconnectivity. At the same time, I understand that more than 5 people may be what the soul needs at this time. So I think that that's a judgment decision. You should take one at a time.
Okay, so this gets us to something else, the whole notion of breakthrough. Even though
Mhm.
you've been vaccinated. We recently lost Secretary of State Colin Powell. Yes, he did have an underlying condition, a blood disorder, multiple myeloma, blood cancer. Um, he passed away from COVID complications. He was fully vaccinated. How do these breakthroughs happen? And are they really, I don't want to say just for, but are they
Sure.
really for people who have other conditions, underlying conditions?
So there's a couple of things we have to essentially separate here. One is the information that we're given around Colin Powell's death is very limited. So COVID complications is a blanket term. It can mean a variety of different things. So we don't know exactly what the cause of death was. Second of all, multiple myeloma is like a disease of your plasma cells, and it affects certain cells specifically and causes them to replicate faster. Now, the treatment for that can be very harsh and affect the immune system. So he wasn't just a well man; he was an actually sick individual in terms of his health status, and so the susceptibility is still increased despite having a vaccination, just because general health condition and deterioration, right? And then I
Mhm.
think the last thing that we have to state is, the virus still has effects on individuals across the spectrum. It is likely that you can be a person who's vaccinated and get uh, COVID-19 and still have a respiratory condition and still have the need for, some supplemental oxygen support. I've seen it with my own eyes. The problem here is misconception, believing that because you are vaccinated, you are immune. It does not mean that you are immune. It means that your symptomatology is going to be lessened.
Huh. And so let's talk about variants. We were talking about Delta, Delta, Delta. Is that still the variant that is the most prevalent, the strongest, affecting people the most, or are other things kind of naturally mutating that are popping up that you're seeing?
I think that the predominant one we still see now is the Delta variant. There are mu variants also being reported, and then in different corners of the world, you're having variants reported at higher frequencies. The main thing to get from this is that is a small change in a structure, but the basic organism and the same things that it causes are happening across all variants. It's not like one is now causing a different set of a pattern or set of conditions that we have not seen before. And so the same management strategies we used for the alpha variant are being used, but at a more, I would say, sophisticated clip than before, because we've had more practice, more experience treating patients who come in with all of these variants.
So let's talk about the world. Again, our Bloomberg vaccine tracker. Enough doses have been administered around the world to inoculate, vaccinate about 44% of the global population.
Right.
But distribution is lopsided. We've seen it in this country, it's lopsided on a global level. If you live in a wealthy, higher income country or part of the world, so think US, Western
Right.
Europe, UK, you are likely to be vaccinated 20 times faster than someone in a less fortunate country or part of the world. Sitting here in New York, why should that, aside from my human feelings, hopefully, why should that matter to me? What's going on a global level?
Sure. So, vaccine equity has and always will be at the center of this conversation. Initially, vaccine equity was thought of very domestically, like how can we get poor individuals in the US or people who are from marginalized communities in the US to get access to the vaccine.
Mhm.
And we were very myopic in that thinking because it was about what we could see at that time. But when you broaden your scope, you see that in the world, the access to the vaccine is differential. And like you said, 20 to 1 is the ratio. I actually think that it's probably a lot higher than 20 to 1. And that's because it's going to be underreporting. With that stated, the globally we still have tremendous poverty. We still have limited resources, limited access, even though we have organizations that seek to improve these conditions. But it brings that ethical piece to the forefront where you're like, we're giving out third doses, and some individuals will probably have had a fourth dose. We even have better treatment for those who do get COVID-19. And are those same treatments and vaccination abilities spread equally across the world? The answer is no. We have to be very vigilant in trying to answer this question about making sure that vaccine distribution is equitable, that there are people who have the opportunity to at least decide when there are individuals who choose not to have the vaccine at all. The luxury of being able to make a decision as opposed to not being even shown the opportunity to have that.
Right. And I want to come back to that. But again, selfishly, think of me as a very selfish person. Why do I care if other tranches of the world are
Mhm.
not vaccinated? Is it because more variants might pop out and then whip back around the world all over again?
Yeah, I think that at its core, the real concern is if you're trying to get to this kind of hypothetical herd immunity, you're going to need to have those who don't have access vaccinated. You're going to need to get the numbers as high as possible to prevent the likelihood of severe mutation. And also,
Mhm.
you don't want to see, I would say 1 to 1.5 to 2% of the world population die because of a decision that we could have made and prevent that. I think that that's really significant to note.
Right. And so right now, path to immunity, current vaccination rate, I think we're at around 800,000 doses a day, right? But
Right.
at this rate, it'll take another 3 months to get to the US population to um, to cover 75% of the US population. It's going to take another 3 months at the current rate.
Right.
Uh, and then we have the resistors. Is it still a reasonable expectation to think that we are going to get to herd immunity?
I think that is reasonable. At this point, is the asymptote that we're shooting towards. I don't think that we'll ever actually achieve herd immunity simply because, again, there's personal choice. There's individuals who are educated and can make the decision to not get vaccinated based upon the science that they understand. What I do think is possible is in clusters, you can have herd immunity. At your office, you can have herd immunity. In your circles, you can have herd immunity, and that allows you to get some semblance of the life that you once really looked forward to. So I don't know if it's going to be globally or even nationally a reality. I do think that in our small pockets we have the potential to achieve those things.
And can we look, and I do want to get on to just some broader health questions very quickly, but is this something that I'm asking you a crystal ball question, but is this based on what we know about other illnesses, about other diseases? Is this just going to naturally sort of peter out, or is what we're doing now, is this our new normal until it just isn't anymore, and it's impossible to guess when that might be?
That's a tough question to ask because I think that there are some, for example, we look at chicken pox and we see that,
Mhm.
all of us had chicken pox when we were kids, and children now almost never see chicken pox.
Right.
It's a very rare thing. Doesn't mean that it's not there. It's just in such a low frequency that we don't see it as often. And I think that there's a potential for some of the viral syndromes to go in that direction. Do I think that coronavirus is going to go that way? I don't. I honestly think that we're still very early in how this is manifesting. So, at some point, will we be able to say that we live in a society where a coronavirus isn't having a significant threat? Probably, but it's not in the next 6 months. It's not in the next year.
Wow. And while we're being distracted, and rightfully so, by coronavirus, you're an ER physician and professor. Um, what aren't we paying attention to? What is happening to the health of Americans, especially
Mhm.
underserved, marginalized communities who always had more difficult health situations? What's happening to people while coronavirus is taking up so much space and time?
So I think that one thing to really, really look at here is over the last essentially 2 years at this point, one in I would say a year and 9 months, a year and 10 months or whatnot, we're seeing that there has been essentially chronic neglect of personal health because of adherence to a lot of the health measures and even a generalized fear of accessing the healthcare system. Right? You know, you still have the underlying conditions that people had at the beginning, like pre-pandemic, and throughout the pandemic getting access to a physician became harder. Some individuals are a part of the digital divide where they did not have the resources to do telehealth or see a physician virtually. And so those appointments became farther and fewer in between. And then finally, in the emergency departments, we're seeing the fallout of that. Our volumes are increasing, not just because we're in flu season and we're still in a pandemic, but because the fallout from chronically under-addressed health issues, things, simple things that have essentially been like neglected for a while: diabetes, hypertension, heart disease. These continue to ravage our communities. And so what I'll state is, for people of color, specifically in the Black community, we've got to really be vigilant and really diligent in how we address our personal health, using every single resource at our disposal, and not losing sight that these are the things that are the top killers. Just because coronavirus over the last year has increased deaths and mortality rate, we still are more likely to die from heart disease. We're still more likely to die from complications of diabetes and hypertension, strokes. These are the things that are taking Black people out much faster than coronavirus.
And Dr. Bim, my last question or talking point with you is that you're the Chief Impact Officer of T.R.A.P Medicine, which is a community-based practice, if you will, a point of view, an approach.
Mhm.
Do, is there not enough attention? Is there enough respect given to community-centered um, medical programs or social programs where you look at the patient and everything around that patient? So it could be coronavirus, but it could be hypertension, it could be pollution in their neighborhoods. Is that happening at a sufficient level?
This is one of the things that we talk about often within our organization. Jamil Lacey is a visionary. He's been able to bring us together as sort of I would say, like an Avengers squad
Mhm.
to address this issue. And what it comes down to is healthcare has been practicing the same, or has been using the same approach for the last 50 some odd years. And disruptive ideas such as taking the safe spaces in our communities and cultural hubs in our communities and activating them to be centers of health isn't commonly adopted. It isn't something that is embraced as setting up another brick and mortar that there's going to be some hesitation to access, because people of color continue to have mistrust of healthcare systems. But you know who they trust? Their barbers. You know who they trust? Their hairstylists. They trust their nail technicians. They trust their church members. And so these places have already gotten past the hurdle of getting approval by the community. And so what they lack are the physicians, the people, the messengers, the folks who understand the science and who can communicate and link them to care, link them to
Mhm.
resources. So with T.R.A.P medicine and other barbershop based health interventions, our goal is to take community engaged care to the next level. It can't be just show up to this office space and you get care from someone who you may have met once or twice a year. It should be around people who the judgment for your behaviors isn't there. It's more so encouragement and constant reinforcement of positive behaviors for your health.
Dr. Italo Brown, that's going to be the final word. Thank you so much for talking with us today. Keep up the good work. Dr. Italo Brown, Assistant Professor Emergency Medicine at Stanford Hospital. That'll do it for this week's Black in Focus. Next week, a force in the content space. We'll be talking with Charisse Clark-Sars, the founder of Harborview Capital. Cannot wait. Until then, I'm Karen Toulon, and this is Bloomberg. Have a good day, everyone.